Hey everyone, welcome back. We're going to be switching gears a little bit today. Usually we're knee-deep in earnings calls, but some breaking news just dropped that's way too big to ignore. We're talking about Eli Lilly and their obesity drug, Zepbound, and a major decision from Medicare. This is big stuff, folks.
Yeah.
Huge for the pharmaceutical market and healthcare policy. So if you're interested in those areas, you're in the right place.
Yeah, it's a really fascinating development, and the implications are far-reaching.
So here's the deal. Medicare Part D plans can now cover Zepbound for obstructive sleep apnea. Now, this is a pretty big shift because, as many of you know, Zepbound isn't currently covered by Medicare or most insurance plans, specifically for weight loss.
Right, and that's why this Medicare coverage for sleep apnea is so significant. It opens up like a massive new market for Zepbound.
Yeah.
And it could set a precedent for future coverage of obesity drugs for other conditions, too.
It's like they found a side door into Medicare coverage. Exactly. It's a brilliant strategic move by Eli Lilly, and, both Novo Nordisk and Eli Lilly are researching their weight loss drugs for conditions like fatty liver disease, chronic kidney disease, and, of course, sleep apnea.
And think about it. There are an estimated 20 million people in the U.S. with moderate to severe obstructive sleep apnea. That's a huge potential patient base right there.
Huge. And let's not forget about the bigger picture here. If Medicare starts covering obesity drugs for related conditions, it raises the question, could this be a stepping stone to them covering these medications for weight loss itself? The cost implications are massive.
Yeah.
We're talking about a potential cost to taxpayers of $35 billion over the next decade if Medicare were to cover all obesity medications for weight loss.
That's a staggering figure, and it
Yeah.
really highlights the magnitude of this decision.
Yeah, to really grasp why this is such a game changer, we need to understand the current Medicare coverage rules. So Medicare Part D plans can only cover obesity drugs if they're used for another medically accepted purpose that's also FDA approved.
So it's like they had to find a way to check all the boxes, and they did with sleep apnea. It gives Eli Lilly a real foothold in the Medicare market, even without direct coverage for weight loss.
It's a win for Eli Lilly and potentially for patients struggling with sleep apnea, but this is just the beginning. It'll be fascinating to see if this decision influences other insurance companies and how they approach coverage for obesity medications in the future.
Yeah, definitely something to keep an eye on.
Yeah, this Medicare decision, it's a significant development, but as with any major policy shift, there are bound to be challenges.
Right, it's not all smooth sailing.
Yeah.
One of the biggest concerns, I think, is the potential impact on healthcare costs.
Absolutely. Covering Zepbound for sleep apnea could significantly increase healthcare spending. And remember that $35 billion figure we mentioned earlier? That was just an estimate for covering obesity medications for weight loss. Now that we have coverage for sleep apnea, the costs could rise even higher.
So we have this potential benefit for patients, but it comes with a pretty hefty price tag.
Exactly. And that raises some serious questions about the sustainability of Medicare and the potential burden on taxpayers.
It's a tough balancing act. On one hand, we want people to have access to treatments that can improve their health and quality of life. On the other hand, we have to be mindful of the financial implications.
It's a complex issue, and there are no easy answers. Another concern is the potential for health disparities. Even with a condition like sleep apnea, access to these medications could be uneven.
That's a valid point. Will everyone who needs Zepbound be able to get it? Or will those with better resources have an advantage?
It's something we need to watch closely. We want to make sure that access to these potentially life-changing treatments is equitable and doesn't widen the gap between the haves and have-nots in our healthcare system.
It's a reminder that even when we see these positive developments in healthcare, there are still these systemic issues that need to be addressed.
Now let's shift gears a bit and talk about the debate surrounding the definition of obesity as a disease.
This is where things get interesting. There are some pretty strong opinions on both sides.
Right. Some argue that obesity is a matter of personal responsibility, a lifestyle choice. Others view it as a complex chronic disease with biological, genetic, and environmental factors at play.
And this debate has real consequences, especially when it comes to insurance coverage. If obesity is seen as a lifestyle choice, then there's less support for covering treatments like Zepbound.
Exactly. The way we frame obesity influences our attitudes toward treatment and shapes healthcare policy.
And it impacts the stigma surrounding obesity. People who struggle with their weight often face judgment and discrimination. This can be incredibly harmful and prevent them from seeking help.
We need to move away from simplistic explanations that place blame solely on individuals. Obesity is a multifaceted issue, and we need a more nuanced and compassionate approach.
So while this Medicare decision is a step forward, it also shines a light on some of the broader challenges we face in addressing obesity as a society.
It's a reminder that there's still work to be done. We need more research education and a commitment to creating a supportive environment that empowers individuals to make healthy choices.
Now, I know you're all waiting for it. Let's lighten things up a bit and move on to our This Is Not Financial Advice segment.
Ah, yes. The time for speculation and outlandish trade ideas has arrived.
Remember, folks, this is purely hypothetical and for entertainment purposes only. We are not financial advisors, and this is definitely not investment advice.
I think everyone understands the disclaimer by now. Let's hear this wild idea.
All right, so imagine you're feeling particularly bold and contrarian in your investment strategy. What if you decided to short the stock of companies that manufacture sleep study equipment?
Short, the companies that diagnose the very conditions Zepbound is now approved to treat. Interesting. That's certainly a contrarian approach. Explain your logic.
Well, with Zepbound gaining traction as a treatment for sleep apnea, wouldn't the demand for traditional sleep studies potentially decline?
So you're betting that the convenience and efficacy of a medication like Zepbound will disrupt the existing sleep apnea diagnosis market.
Exactly. It's a gamble for sure, but sometimes the biggest risks yield the biggest rewards.
Again, listeners, this is purely speculative. It's fascinating to think about the potential ripple effects of this Medicare decision and how it could disrupt various sectors within the healthcare industry.
It's a story that's just beginning to unfold.
Indeed. And we'll continue to follow it closely and bring you all the latest insights and analysis. But for now, let's wrap up part 2 of our deep dive.
Welcome back to the show. So we've spent the last 2 parts of this deep dive really digging into this breaking news about Medicare covering Eli Lilly's Zepbound for sleep apnea. We've talked about the potential benefits, the cost concerns, the issue of health equity, and even explored some pretty out there trade ideas. Now let's kind of shift gears and look towards the future.
Yeah, it's been a fascinating discussion so far. And I think this Medicare decision could be a real turning point. It has the potential to really reshape how we think about and treat obesity in this country.
So paint me a picture. What could this future look like?
Well, I think this decision could be like a catalyst for wider insurance coverage of obesity medications. If Medicare is covering Zepbound for sleep apnea, it could encourage other insurers to reevaluate their policies and potentially expand coverage for obesity drugs, not just for related conditions, but, for weight loss itself.
So this could be bigger than just sleep apnea. It could impact how we approach treating obesity as a whole.
Exactly. And with that expanded coverage, more people could have access to effective weight loss medications. This has the potential to lead to a significant improvement in public health. We could see a reduction in obesity-related diseases like type 2 diabetes, heart disease, and even some types of cancer.
That's incredible to think about. By addressing obesity, we could be preventing a whole host of other health problems down the line.
It's a ripple effect. And let's not forget the potential economic benefits. Preventing or delaying these chronic diseases could lead to significant cost savings in the long run.
It sounds like a win-win situation. But let's be realistic here. There are always challenges. What potential hurdles do you see on this road to a healthier future?
Yeah, you're right. It's not all going to be smooth sailing. I think we need to think carefully about how to implement these changes. One key issue is ensuring equitable access to these medications. We need to make sure that everyone who could benefit from them, regardless of their background or resources, can actually get them.
That makes sense. We don't want to create a system where only certain people have access to these potentially life-changing treatments.
Exactly. We also need to be mindful of the costs. Wider coverage means more people using these medications, which could put a strain on healthcare budgets. Finding a way to balance access with affordability is going to be crucial.
It's a delicate balancing act.
Yeah.
And I imagine ongoing research is going to be critical as well.
Absolutely. We need to keep learning more about the underlying causes of obesity, the long-term effects of these medications, and how to best integrate them into comprehensive care plans.
So it's not just about prescribing a pill and calling it a day. It's about understanding the complexities of obesity and tailoring treatment to each individual.
Precisely. And that's where personalized medicine comes in. Not everyone who's obese needs medication. For some, lifestyle changes like diet and exercise might be enough. For others, medication could be a helpful tool, but it should be used in conjunction with those lifestyle changes.
It's about taking a holistic approach, recognizing that obesity is a complex issue with no one-size-fits-all solution.
And that brings us to another important point: the need for public awareness and education. We need to continue the conversation about obesity, challenge harmful stereotypes, and promote a more nuanced understanding of this condition.
It's about moving away from blame and shame and fostering a more supportive and understanding environment.
Exactly. By doing that, we can create a society that truly embraces health and well-being for all.
This has been an incredibly insightful deep dive. We've explored the potential of this Medicare decision to transform not only obesity treatment, but also our entire approach to healthcare. It's a story filled with hope and challenges, and it really highlights the importance of ongoing research, thoughtful policies, and open dialogue.
It's a story that underscores the power, innovation, and the importance of collaboration in addressing these complex public health issues.
We hope you've enjoyed this three-part special. Be sure to subscribe and join us again for future deep dives into the most fascinating developments in healthcare and beyond. Thanks for listening.